All right, so we just finished talking about synchronized cardioversion. So now let's go a little bit deeper into synchronized cardioversion and talk about exactly how to do this successfully. So your indications, we just talked about it in the previous video. Unstable symptomatic tachycardia, adult heart rate greater than 150 beats per minute, or afebrile pediatric heart rate of greater than 180 beats per minute. Again, remember for pediatrics, we have to call online medical control. And hemodynamic compromise with adult systolic blood pressure of less than 100. And pediatric systolic blood pressure less than 70 plus 2 times the age in years. Your contraindications for synchronized cardioversions is going to be your stable tachycardia. Obviously, we're not going to cardiovert a stable patient. A normal sinus rhythm, again, doesn't make any sense to cardiovert them. Bradycardia, that's already slow. We don't want to make it any slower, or VFib and pulseless VTAC, because we're going to defibrillate those patients. So your technique for cardioversion in these unstable tachycardic patients, your monitor's probably already on at this point. You've already confirmed your rhythm and done all that. So you attach the patient ECG cable and ECG electrodes. That's when you're going to determine what the rhythm is. You're going to select the lead with the greatest QR complex amplitude, positive or negative deflection. And there's a reason for that, as I'll explain here in just a second. As we talked about in the last couple videos, there's the sync button. So here is the figure. You can see it on figure 3 pretty clearly. It's lit up. You're going to hit that sync button, and then you'll start to see those green arrows on top of the QRS complexes on your monitor. So to deactivate the sync mode when not synchronized cardioverting again, you just press that button again and it'll go away. So we'll scroll down here. You observe your ECG rhythm. Confirm that triangle sense marker appears near the middle of each QRS complex, as shown there again in figure 4. If you look, I'll try to zoom in just a little bit. You've got your SVT, it looks like, and you've got your sense markers right above the QRS complex. That's what you want. If for whatever reason it is not above that QRS complex, for example, it's on the T wave, all you're going to do is adjust the ECG size or select another lead. To select another lead, you just hit that lead button that is right there. Right there, and you'll change whatever lead. And then we talked about changing the sizes earlier. So that's what you'll do if they're not on there. You'll connect the therapy electrodes to the therapy cable, just like you would for defibrillation, and then prepare the patient's skin and apply therapy electrodes to the patient in the anterior posterior chest wall position, which is shown there again in figure 6. Number 8, press energy select or rotate the speed dial. We talked about that several times. You can do your energy select like you would on defib right above the charge button, or you can do the speed dial as shown there in figure 7. We're going to start at 100, and then if it persists, we'll repeat the cardioversions at 200, 300, and 360. For pediatric synchronized cardioversion, again, consult online medical control for treatment plan and energy settings. You'll press charge. While the monitor and defibrillator is charging, a charging bar appears. It's just like it would on defibrillation when you're running through your cardiac arrest. You're just cardioverting and not defibrillating. So number 10, just like you would in a cardiac arrest, you'll make certain that all personnel, including the operator, stand clear of the patient, bed, and any equipment connected to the patient. Number 11, confirm your ECG rhythm, confirm available energy. Prior to delivering synchronized cardioversion, it is paramount to ensure that the sync mode message continues to appear. Failure to deliver a synchronized cardioversion in this setting could cause ventricular fibrillation, cardiac arrest in this patient. So, and it's yellow for a reason because it's very important. All that this is saying is you want to make sure that that green light on the sync button was lit up and that you have successfully accomplished getting that sense marker on top of your QRS. If you do not see that sense marker on top of your QRS, and you select your energy and charge it and shock, then you are defibrillating that patient and not synchronized cardioversion. So that would be a big no-no. So make sure that you don't do that. Make sure before you press that charge button or your shock button that you still have your sense markers on top of your QRS complexes. Number 12, press and hold the shock button, which is that lightning bolt, on the monitor until energy delivered message appears on the screen. Note, to disarm, cancel the charge, press the speed dial. The energy disarms automatically if the shock button are not pressed within 60 seconds or if the energy selection after charging begins. So if you charge it up and for whatever reason you realize, oh, we don't have our sense markers or whatever's going on, if you just hit that speed dial there at the very bottom, it will disarm that charge. Same with defibrillation. And then lastly, observe the patient in the ECG rhythm and then repeat procedure starting from step 4 if necessary. So pretty simple for cardioversion. Again, it's just your unstable tachycardias. You'll press sync on the monitor. You'll get that sense marker on top of your QRS complex. You'll select your energy, either from the energy select buttons right below the on button or your speed dial. We'll start at 100 on this, and then you'll charge it, make sure everybody's clear, and deliver your shock.